When you stare at something for 2 years, something that's really, really important, like a tiger, you know every normal behavior, every facial expression, every part of his body, every stripe. And when something's out of place, it stands out to you. I noticed that his face was just not quite right. It took me a minute. I kept staring at him, and then finally I said something to the other caretaker, and he agreed that something was there, and I wasn't crazy. I called Dr. Baker from inside the night house right then.
The diagnostic test revealed the mass inside of his skull. We originally did it to check his teeth because as I said, we thought there was a problem with one of his teeth.
In my mind, he wasn't old enough for that to happen, but I mean, cancer does what cancer wants, and it doesn't matter how old you are, who you are, or what species you are.
So there were many layers of collaboration between Cancer Center team members and the vet school team members on a number of different fronts, whether it be logistics, so transportation, that was a big part of it, that required a lot of careful planning.
Anesthetizing Mike in his night house, safely keeping him on anesthesia during the whole transportation, keeping him safely anesthetized during the whole time in the hospital, and make sure that he would not wake up or become light on anesthesia, and safely recover him to go back to the night house.
Positioning is very critical in radiation therapy because of how precise our treatments are. Most of the time, patients can assist us in positioning themselves and getting aligned correctly. We didn't have that with Mike. Not only was he much heavier than just about all patients that we deal with, he was also unconscious, so we needed a lot of assistance in moving him around the room.
Both groups are medical professionals, just working on different species. It was really enjoyable to be a part of that and to watch the two groups work together.
The veterinary oncology team was great to work with. Everybody worked together as a team, especially about the first day, the first time when he came for his CAT scan. We were unsure of what all was expected, but we jumped right in and everybody worked together. And the second time he came for the treatment, it was seamless.
We had hoped for longer, but he did have a few extra months of high quality life. And you know, when you look at the length of his life, a few months is a significant percentage increase in his life.
It did mean a lot to me as a professional, and of course that was an honor, as it is any time that anesthetize a big exotic animal, but especially for Mike because he was such a magnificent cat.
Mike 6 was really a special tiger. All of our tigers have been well loved by the LSU community, but this one had such an engaging, confident, interactive personality that people really took to him immediately. In 20 years of working with the tigers, I've come to appreciate just how much the LSU community loves Mike the tiger. He is a symbol, he's more than a symbol, but he is a symbol for people of everything good that they remember about their time at LSU.
He was an important part of our community and our history and our school, and that's why I wanted to be his caretaker. I wanted to be part of something that was bigger and important. Just being around him is pretty special.